Okay, it looks like we have you as our patient here today at Dream City Clinic. Hi there. I'm just going to quickly scan my identification card in. And let's just check myself in before we get to your appointment, okay? Perfect. Hi there. I am Nurse Cece. It seems you're here today at the Dream City Clinic for an in-bed exam for the full cranial nerve and full examination head to toe to make sure your health is doing okay. Is that correct? Great. I'm just logging myself in. I just sanitized my hands. Pleasure to meet you. Yes. And how are you doing today? So what's been bothering you? You've just not been able to sleep. Well, that's okay. We will analyze that. Let me grab a seat. So for the in-bed exam, we want you to lay down while we conduct this medical exam. While you rest in bed, I'm going to drop the back of the rest and then we'll begin, okay? I'll tell you what we'll do while I drop it. I'm just logging you in. Can you first tell me your first name with the spelling? Okay, do you spell that with an I, E, Y, or none of the above? Okay. And then could I get your last name? And do you happen to have like a middle name or initial? Good. And your birthday with the year, darling? Ooh, does that make you an Aquarius? I don't know much about zodiac. I always just like to relate. And then before we begin, do you have any allergies we should know about? Okay, we'll make sure to not have any of that. Or any sensitivities to perfumes or scents. Okay. I'm gonna lay your bed down just a little bit before we begin. Tell me, are you more relaxed with this? I'm just going to adjust it carefully, okay? And how is that? Good. I'm going to get some gloves on. What we'll do today is just a basic medical exam. And we're going to test several things that I'll show you very soon. And we're going to help find out what helps you fall asleep. Are you okay with me being your nurse today? Because we can grab any other nurse as long as you're comfortable. Okay, if that changes at all, I want you to let me know as soon as possible. Great. So let me show you what we're going to do. We're going to do a basic cranial nerve assessment here, along with other medical assessments. And that is my degree of nursing I got at YouTube University. Ready to begin? Great. So first, I'm just going to ask, may I just carefully touch your face? I want you to let me know if you can feel that. Just basic vitals before we get the real ones. Can you feel that? You have a beautiful face. Your eyes just look a little bit red and tired. When was the last time you fell asleep? I can tell. Just keep laying back. Okay, I'm going to put some pressure on the jawline. Can you feel this? Okay. Have you had any difficulty with any cold or flu within the past 2 weeks? Any friends or family with it that I should know about? Okay. Do you have seasonal allergies? Can you feel when I put pressure on your head as well? And what about there? Okay. Can you look at me? Good. Can you look over here? And here? These are just basic vitals. I'm looking to see if there's any issues that I may be wary of. Okay. Do you wear contacts or glasses at all? Okay. And do you wear glasses for blue light? That's for looking at the phone screen or a computer screen, tablet, anything at school or work. Okay. Good to know. Okay. Before I check your vitals with your heart and rhythm of your breathing, can you look at my eyes? I'm looking for something called nystagmus. A little bit of education for you as well with this. Just look at my eyes. Follow my eyes. Good. Follow my eyes this way. Good, and follow my eyes right at the center. Okay, I'm going to move my eyes a little bit up. Are you able to do that? Okay, follow my eyes, and can you follow my eyes all the way down? Okay, good. I don't see any signs of nystagmus. That's just when your pupil moves back and forth with the repetitive motion. It's unintentional. It's just something we always check for in case there may be a concussion or some sort of vertigo. Do you experience vertigo? Okay, and if you do, when was the last time you had an episode? It's very common. I experience vertigo all the time, so nothing to be shy about. Okay, I'm gonna quickly check your basic vitals now, so your heart rate, your breathing, okay? It's gonna be a little cold, so I just want you to work with me, okay? Good. So I'm gonna put this right there on this side of the shoulder next to the chest and the clavicle. It's gonna be a little cold. I just want you to breathe in, breathe out, and let's listen carefully. Good. Breathe in, breathe out. Good. Other side now. Again, might be a little cold. Breathe in. That's good. Breathe out. Breathe in. Breathe out. Good. Okay, I'm going to put it right at the center, right there. Breathe in. Breathe out. That sounds great. Breathe in. Breathe out. Heart rate sounds amazing. We're going to listen to the stomach now. When was the last time you ate? Okay. Just listening carefully. Right there. Okay, that sounds good. Any stomach pains that I should be of knowing or concerned about? Okay. I'm going to listen to your lungs now, so I'm going to reach all the way to your back. I'll tell you when to breathe, okay? So, could you breathe in right now? Breathe out. Good. To the center. Can you breathe in? Good. Breathe out. To this side, breathe in. Good. Breathe out. Good. Okay, lung signs sound good. Do you have any asthma or any lung conditions I should know about? And remember, if you don't want to answer, you don't have to, okay? It's just between me and the computer and the doctor. Okay. You doing okay so far? Do you want an extra pillow or perhaps a drink? We have two types of drinks. We do have water, and then we do have chamomile tea. Nothing right now. If that ever changes, there's a button right to the side of your bed. It's green. If you hit that, one of the nurses, either me or a couple others, will arrive within 5 minutes to help you with whatever, okay? Good. Just typing your information in. So heart rate was good. Lungs was good. The sound of your stomach was good. And when I put pressure down on your stomach, did that feel okay? I'm just going to repeat that a couple times, okay? So can you feel this? Okay. Any pain or pressure? And what about here? Any pain or pressure? Good. Okay, and what about right here to the side? This is close to where the appendix is. Any pain or pressure? Okay, good. I felt no firmness of the stomach and the abdomen. That's great. Do you have any food allergies? For example, I'm allergic to avocado and banana. Okay. Just writing your information down. I'm going to quickly check your eyes. Let's just dim a little bit of the lights in this room before bit? Could you look at that light over there? It's just from my pen light. Good. Can you see that? Good. I'm going to move the light a little bit closer now. Okay. And is that bothering your eye at all? Okay. Can you follow it up? Follow it down. Look back at the center. Good. Follow the light right to the center there. Down there. Good. And back to the center. Okay. I'm going to move the light away from your eye. And quick question, how many fingers am I holding up? What about there? Okay, what about here? Here? What about there? And here? And there? And here? Okay, 3 and 3. Really quickly looking at me. Are my hands getting closer or farther away from you? I'm gonna sit back about a meter. Are my hands getting closer or farther away? Let's start. Closer. What about now? Farther away. And now? Closer. And what about now? Farther away. Okay. Which hand is getting closer? Look carefully. Left or right? Good. Left. Once more, left or right? Right. Good. Which hand's getting closer, left or right? Left. One more time. Left and one more time. Right. Okay. Left, left, right. Okay. That's great. I'm going to get a little bit closer to you. I'm going to remove this though too, because I'm going to get very close to you. Just relax. What I'm going to do is I'm just going to bring the pen light back, and I'm going to take a couple of photos of your eyes, okay? We're then going to test your eyes with a couple of color exams. So I'm just going to get really close and I'm going to take a couple photos of your eyes. Just look at the light. Good. Look at the light. 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 And look at the light. Good. We're going to take some photos inside your eyes now. So, I'm going to look into your pupils and into your retinas, and we're going to be just examining deep into your eye so I can send this information to the doctor. Let's turn the light on. Okay. And I'm going to just take some photos. I just want you to keep focusing at the light that's right there, okay? Let's take a couple of photos. Look at the light. Picture 1, 2, 3, 4, 5, 6, 7. Okay. 8, 9, 10, 11, 12, 13, 14. Okay, 14 photos that progressively zoom into the eye. Can you look at the light on this side now? Is it bright? Good. I'm just going to take some photos. So we're going to go all the way to photo 14 again. It zooms in slowly. 1, 2, 3, 4, 5, 6, 7. Great. Halfway there. 8, 9, Good, and then look right at the center. One more round. We're gonna go to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. Okay, 14. So we're going to send that on to the ophthalmologist here at Dream City Clinic. Okay, ophthalmology laboratories. How are your eyes doing? I can see that one made you tired. In addition to the heartbeat analysis, which has helped close your eyes. Okay, looks like we're going to tire your eyes out more. I'm going to quickly open the window once more so we can see a little bit better. And we're going to give you a color analysis with your eyes. So, we're going to test for color blindness. Okay. I have these color panels here. And I'm going to put these over your eyes. And you let me know which color you see. Do you have any color partial vision right now? If you do, I want you just to try your best, even if it's incorrect, okay? Good. Let's begin. What color is this? 3, 2, 1. Hot pink? Yes, indeed, that one is hot pink. Good job. Okay. I'm gonna ask you some colors now. 3, 2, 1. What color is this one? Is it yellow or green? 3, 2, 1. It is a bit more yellow than it is green, right? Good. Can you still see the blue on my nurse's outfit? Good. Okay. 3, 2, 1. What color is this one? Look carefully. Is it purple or is it blue? 3, 2, 1. It is purple. Does it come off more purple or more pink? 3, 2, 1. A bit more purple, but for some, it can come off a little bit more pink. Let me know your results in the comments below what you got, okay? Good. Okay, what color is this? Take a look. 3, 2, 1. Is this more blue or is it more green? 3, 2, 1. It's a bit more green, but again, for those, it might seem a bit more blue. Can you still see the blue on my shirt? You can. Good. So a bit more green. I'm writing that down. Okay. What color is this one? 3, 2, 1. This one is either red or pink. What's your guess? 3, 2, 1. Pink. Good. Can you still see the blue? Good. What color is this one? 3, 2, 1. This one is either green or blue. 3, 2, 1. It's blue. Did it make my shirt more blue or is it the same blue? 3, 2, 1. Good. It made it a little bit more blue. 2 left. You're doing great. What color is this? 3, 2, 1. Is it orange or yellow? 3, 2, 1. It is yellow, but the actual color is a light orange. Some might even call it a hazy yellow, as if it were a cloud in the sunshine on the sunset. Good. Can you still see the blue? 3, 2, 1. You can. Good. On to the last color. What is this one? 3, 2, 1. Good. This one is either purple or red. What is it? 3, 2, 1. It's red. Good. Okay. Can you see that light with this red one? We're going to do a quick red test. You can see the light? What about there? Can you see the light? Good. Is the light white or is the light red? White and red. Is the light getting closer or farther away? Closer. What about now? Farther away. And what about now? Closer or farther away? Closer. Good. Does my shirt still look blue or does it look a bit purple now? 3, 2, 1, a bit purple. And did it wash a color completely over your eyes? It did. Okay, good. Okay. That is the red color panel test. Thank you so much. And how are your eyes feeling now? You do look a bit more tired than before. Good. The last thing we're going to test is your ears, known as your vestibular system. I'm going to test with a couple of these tools here. And you let me know if you can hear the sound. Can you hear this when I tap on this? Take a guess. Can you hear it? 3, 2, 1. Can you hear it from here? 3, 2, 1. I'll do it again. Yes or no? Nope. Good. A little closer now. Can you hear it from here? One more time. Not so much. Okay, a little closer. Can you hear it from here? Yes. Good. One more time. Yes. Okay. And of course, a little bit closer. Can you hear it a little bit louder when I move it closer? Yes. One more time. Yes. Okay. So you heard it the loudest at the last one, correct? Good. I'm going to move my gloves. Let me know when the sound stops. I'm going to put it next to your ears. Listen carefully. There. Okay, one more time. There. Okay. And listen carefully. When does the sound stop? There. Good. Secondary sound, I'm just going to let me know when the sound stops. There. Again. There. One more time. This will be the most difficult one. When does the sound stop? There. Great job. Okay. I'm going to whisper 3 words into your ears. I'm going to distract you with the sounds of my hands. Let me know what word it is. Let's start. Listen carefully. Sleep. 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 What was that? Sleep. Good. And again, I'm going to make it a bit difficult. Smile. 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 What was that? Smile. Okay. And one last one. Good night. Good night. Good night. Good night. Good night. Good night. And what was that? the most difficult one. That one was. Good night. Did you get that one? Let me know in the comments below if you did. Okay, I'm gonna finish out writing some notes. I'm gonna ask that you relax and close your eyes as I fill out your data. And there might be other exams after this if you haven't fallen asleep. So what I want you to do now is close your eyes, have a good rest of your night, and we're going to re-examine you in the morning, but there might also be exams that follow after this that would help you to go to sleep and to keep retesting until the moment that you do fall asleep and get good rest. Okay, again, I am Nurse Cece. It was an amazing time to take care of your health today. We're going to analyze and see which one of the medical treatments needs any improvement, and we're going to retest in the morning after all the exams are complete. Okay, so relax right there in the medical bed. Please do not move, and we will just continue to analyze you throughout the night. Again, there may be more exams depending on your sleep schedule. And I'm going to help you have a great rest of your night. Cheers. It was great taking care of you today. Just close your eyes and relax. Good. And hello there, dear. I do apologize for waking you at such a late hour in the evening. I am Nurse Luna, and I don't know if you remember, but you had a bit of an accident, and you have quite a cut on the forehead, and a bit of bruising around the area. Do you remember that? Not at all. Okay, well, you are currently recovering in an overnight clinic, and I'm here to make sure that your vitals and general health are okay for a checkup. Is that okay with you? Perfect. So, I've got you all checked in and signed up, and I am the first step before you get any more detailed examinations. Soon you will have a cranial nerve exam, a detailed eye and orbital eye exam, a hearing exam, and then after that a neurological exam to make sure that you're doing 100% okay. Perfect. Now then, I'm going to remove my readers. Preliminary checkup for me though is, may I please just feel around your face to see if the swelling has gone down a bit. Thank you. Going to do a bit of face mapping, which is a bit relaxing, but if you feel any sensitivity and pain, let me know. Thank you. So, just going to carefully just look around the eyes here. Of course, this eye does appear to have some swelling, but it is very, very much better than when we began. And I do see that going down the bridge of the nose. Just going to take a quick look there. Just going to just very carefully just go around the nose, just down the nose, around the corners of the nose. I do see that it's going to be a bit. Just going to take a look there. Now I'm going to very carefully press around the temples of your forehead. This might cause a headache or vertigo. Let me know and I will stop. Just going to very carefully just go around the area. And you're good. Okay. Perfect. I'm now going to very carefully feel around the ears and behind the ears. Okay, so just are you okay? Perfect. No signs of vertigo or pressure, but there is swelling around the eye and the cut. Okay, I'm going to get my gloves on now and I'm going to take a quick pop at your eyes. So, how are you doing this evening, sweetheart? Good. Do you feel any overwhelming sense of pain around your forehead area? That's where you appear to have a lot of bruising. Okay. Well, after the exam, I'm going to remove the stitches and clean the area so you will be 100% perfect again. Good. So, grabbing a penlight. Gonna quickly grab my readers one more time. I'm just going to look in your eyes very carefully. First this one, then the other. Just stay still. A couple quick flashes, just look at me and don't move your head. Thank you. So, very carefully. 1, 2, 3, 4. And a bit more precise now. 1, 2. Are you okay? Good. The other eye, just look at me. So just carefully going to take a look. 1, 2, 3, 4, 5. You do feel a headache going on when I shine into this eye. Okay, that is a sign of a concussion, and perhaps trauma to the head could have caused that reaction. Good to know. I'll try to not shine so much light, but just going to let you know that everything is going to be okay. Everything will be okay. So, first on this I'm going to just pull down on the eye, and I want you to look up for me very carefully, okay? Just look up. Thank you. Good. Relax now. Look down. Think. Good so far. Now, look to your left and to your right. Perfect. Now very quick on the side. Just going to do the same thing. Now please, look up. Thank you. Now look down. Okay, difficulty with lateral movement on the eye. Could you please try and look to your left and to your right? Okay, vertical problem when isolated eye movement is shown. Okay. Vertical isolation problems move to the eye. I'm definitely sending you in for a cranial nerve exam after this, and a very detailed eye exam. I want to make sure you're doing okay. Okay. Now, very carefully, I want you to keep your eye on the light, okay? Just don't move your head, and I'm going to turn the light on and off. Thank you. So, very carefully. Okay, so eye functionality is working good for both eyes when shown light at a distance. Good to know. And movement seems to be perfect. Okay, thank you so much for that, by the way. Hope you're feeling okay. Good. Now, I am just going to take a quick assessment and measure the size of the cut very quickly. So, just don't move. We're going to look at Okay. You've shown a lot of decrease in swelling around the area of the accident, which is amazing news. And you appear to be healing very well. Perfect. That is great news. Healing on wound is going marvelously. That means you'll be able to get out here very soon. Yes. Now, next I'm just going to quickly assess your ears, okay? Thank you. So, grabbing a penlight once more. Going to attach an otoscope onto it, and I'm going to as well just take a quick look into your ears, okay? So, attaching the otoscope to the end. Okay, let's take a look into your ears. Just don't move, okay? Taking a look into your ears. I'm going to just okay, now a bit from okay, and from the side here. Take a look then. Okay. So far, this ear's looking fine. Let's try the other ear now. Just relax. Going to take a quick look inside the ear. Just going to look. So there appears to be trauma to the ear as well, which could be causing the headache and vertigo, as understood. So, okay. Because of the trauma from this ear, I'm going to be giving you a very quick ear exam and an ear cleaning, okay? Good. The trauma to the same side as the cut. Perfect. A quick ear exam, I trust. So, I would like it if you could just very carefully close your eyes, dear. Thank you. And I'm going to be making an arrangement of sounds, and you tell me by raising a hand or just saying it which side the sound is coming from, the left or the right. Thank you. So, I will let you know what the sound is prior, but the first sound is the tapping of a glass bottle. So, let's begin. Okay. Marvelous. And hearing does not appear to be impaired. Now a very quiet sound, which will be the sounds of gloves. So okay. Lovely. Okay. Perfect. Sensitive sounds are marvelous. Good. Going to do an ear cleaning very, very carefully now. And what I'm going to use is just some cotton rounds, okay? Good. Going to get my special anti-inflammatory ear cleaning medicine. And if I'm correct, it's this one. And a mixture of this one. Yes, that's right. So, one of them is made of an antibiotic. So, what I'm going to first get is a bit of that onto a fresh cleansing round. And if you could let me know what that smell is. It's mint. Perfect. Thank you. That was a bit of a quick exam. Just going to apply a bit onto the round. Okay, then I'm just going to apply. Okay, and last but not least, though your health has been overall checked, we're now going to clean that cut, okay? Perfect. I'm going to get a mask on. Just getting my mask on. I'm first going to apply a sterile cleansing cloth.
okay? And one more for clarity. Okay. Now going to carefully remove the stitches. Just have to move, okay. I'm going to get my tweezers. Just going to very carefully perfect. Now we're going to apply an antibiotic cream. So, just don't move. Perfect. And finally, we're going to give you some bandages that will act like stitches. Good. So, and I do apologize for getting so close, but I have to be precise. So, just going to apply that very carefully onto the side of the face. Okay. Thank you for being so patient with me. I do assess that as of right now, you are just in recovery mode. Now that that has been cleansed and rebandaged, I will be heading out, and you can just very carefully go back to sleep. You will have other appointments with other doctors in the morning to make sure that your health is perfect and that you're doing swell. Okay, dear? Perfect. If you need me at any moment for some tea or some snacks, do not hesitate to push the nurse's button. We're just to the side of your bed. Thank you. Have a good night's rest, dear. You are recovering perfectly and you will be amazing soon. I promise. Again, I'm Nurse Luna, and have pleasant dreams. Good night. More assessment needs to be done on the eyes and speak for me, okay? Great. Now for a quick look at your bruising situation. It does appear to be a bit awful. It looks like you got into about 3 fights and you lost all of them. And a lot of bruising and swelling on the chin, especially the under eyes, and super dry around the mouth. So gonna have to apply a steroid cream there, and we have a swelling reducing roller and face mask treatment that also includes antibiotics to heal the inside and outside of the nose as quick as possible, okay? I just want to make sure you feel safe and like you're recovering, okay? Great. Let me get my other glove on. Is the hospital bed a bit comfortable, or do you need a couple more blankets, or... Okay. So, first, what we're going to do is just a quick examination of your eyes. And I'm going to be looking into your nose as well, so got this light, it might be a bit bright, and I know you were just snoozing, so just going to quickly shine this into your eyes, okay? Just quickly. Okay. As well, because we messed with your sinuses, it could trigger some sort of vertigo. If that happens, let me know and I'll stop right away, okay? Good. On the other eye. Okay. Your eyes dilated well, about 9 millimeters, which is pretty normal. Now I'm going to just take a peek at your nose here. And it appears to be recovering well. Does it hurt when I press around the nose? A bit, yeah, that's what I expected. Now, can you try to open your mouth just a bit? I know it might be difficult. Gotta take a look inside there. Okay, so it is a bit of a sore looking area in the back, but it's fine. At least everything looks like it's healing well. Okay. Next, I'm going to do something called a press test. I'm going to press on the areas around your nose and around your throat. If something is excruciatingly painful, please let me know, okay? Great. Now for the press test. your skin heal. We're gonna wipe all that away now.
final checkup on patient 24601 for this evening. Okay. And hello there, dear. I do apologize for waking you up at such a late hour, but I must. Yes. Hello there. I am Nurse Luna, and I am the night nurse here at the clinic. Yes, it is a pleasure to meet you. Now, dear, you are here at the recovery part of the clinic after a nasal reconstructive surgery after quite a fall. Yes, so you are in safe hands, and Great Britain's best plastic surgeon. Yes, so what I'm going to be doing today is a general checkup and a change of the cast, okay? Yes, so just very quick, may I grab your heartbeat? Thank you, love. Again, just please keep your talking tone to a whisper from now on, as there are other patients in the room. How are you? A bit congested, yes, I understand. Yes. So, just going to pop these in my ears, and I'm going to grab your heart rate. Just relax and breathe, okay? Yes, so just breathe. Okay. Very good. Heart rate was perfect. Going to mark that down now. Perfect heart rate. Now, if you'd allow me to, may I grab your temperature? Thank you. So, just going to pop this under the tongue very gently. Thank you. And just let that catch the temperature. And perfect. And a bit cold, understandable. Okay, after anesthesia, that quite does happen often. Drop of temperature after anesthesia. And going to ask you a few questions. May I touch your face? Thank you. Could you let me know if I do put pressure on any part of your face that feels very uncomfortable? Let me know,
I'm now going to do something called a precision face exam. And the precision part comes from the accuracy of how well I can assess the face. We're going to look through your eyes, okay, darling? Just keep looking at me, okay? And relax. Just relax, darling. Now, I'm going to test each eye, and I'm going to see if the swelling has affected any of the eyes. So, just relax, okay? And a couple quick flashes of the light. Okay, so the dilation was at 8 millimeters. Okay, to the next eye. Just keep looking at me, darling, okay? Thank you. Okay. Okay, and this eye was roughly around 8.5 millimeters. Okay, we're going to do a fun little test here, and it is called Follow the Light. Okay, I'm going to be moving the pen light at differing speeds. Just keep up with it. So, very quickly, just follow the pen light. And we're just going to be testing the outside borders of the eye to see if swelling has affected the eyesight. So, okay. Okay, lovely. Now, precision. Okay, lovely. I'm just going to pull down on one of the eyes now. Give it a quick flash. Just. Okay. And the other one now. And very carefully. Okay. Thank you. Perfect. The swelling has not affected the eye. No effects on swelling of the eyes. Okay. Now I'm going to ask if you could please just open your mouth. Thank you. I'm just going to be doing a quick check for dryness, and I do assess that there is. Yes, okay. So, irritation and dryness of the throat, very common after nasal surgery. Okay. And now I'm going to just take a peek, a little pop in the nose. So, ears, and that's to assess if there could be any tinnitus, especially after sinus movement. The ears can be very much so affected, especially after pressure on the nose. So I'm going to be ever so gently grabbing two things that make noise. Now eyes closed, no cheating this time. Thank you. Lovely. Perfect. And I'm going to ask you what sound you hear. Okay. Yes, it's a brush. Perfect. Keep your eyes closed. And now and that was plastic. Good job. So tapping sounds not affected. Perfect, darling. Now that we have assessed that your health is very much so decent, I'm going to do measurements of your face. Now, before and after surgery, we do measure, especially if the nose has been affected. So we're just going to do measurements to see if your face has changed shape. So do not mind me. Okay. So first we're going to measure the forehead. So very carefully. Just going to go from part to part to see if the foreheads have changed. I don't see much of a change here though, as the assessment has been taken prior to surgery, but you never seem to know when you do get affected by trauma. So I do see that we're going for roughly around 433 and 420. Now, let's now assess the nose. So, looking just around this area with the cast, that is, we are still seeing the same length, maybe minus just a dash from the prior procedure. So just going to look and assessing. Just going to take a quick assessment to see if there's anything that it could be assessing better. Okay, so angle 39 and structural 303. So going to check now from nasal width. I'm going to see if there's anything that could have been differing from this amount, and see if there could be a static change. And I don't see much of a change. let's remove that now with just a bit of delicate touch. So, okay, we have removed the first bandage and let's apply the second one. I'm going to need an adhesive to apply this, and I'm actually going to be using an adhesive that smells just like eucalyptus. So it's going to be wonderful. Before I can do that though, I'm going to use an alcohol wipe to cleanse the nose and prepare it for the secondary adhesive. So just going to be grabbing the wipe, just going to be very quickly. Very carefully, just okay. Okay, now I'm going to apply some sterile antibiotic cream with a bit of a cotton swab here, and just going to apply just a dash onto there, and we're just going to apply it very carefully. Okay. Now we're going to take our non-adhesive pad. This will mold into a cast once I apply the oil, but I'm just going to remove it. We're now going to place it gently on the nose, so right like that. Perfect. And let me get the adhesive oil right here. And just a dash will do you. Perfect. Again, if you could smell this oil, it is just so lovely. But it's perfect for applying the adhesive. So now, just a touch. Perfect. Let that set for a bit. We're going to call that complete. So, now that that's all done, how do you feel? Very tired. Okay. Would you like me to bring you anything? Tea, water, some soup? You're good for now, okay. I will be back in the morning to change the cast out once again and check your vitals, but you seem to be okay for now. And everything seems to be fine. I'm going to also reassess your face once more as you wake up to see if everything's going well, okay? Perfect. Well, dear, have an amazing, good night's sleep. And if you need any help, please push the nurse's button to the side of the bed, okay? Perfect, darling. Again, I am Nurse Luna if you need me. looks like you will be healing up in no time. Okay? Good. So, assessment was perfect. Patient is doing swell. Hello there. Bonjour. Welcome to Dream City Clinic. I am Nurse Geneviève. I am taking care of you this evening. Yes. You are currently under our care. Yes. And I'm here to do a quick before bedtime checkup while you are in bed, okay? Good. The first question I would like to ask you is, how are you? Mm-hmm. Mm-hmm. And another quick question. Do you remember why you were in a bed in a clinic? Yes. You had your tonsils removed due to an infection, and because it was a bit bad, we had you stay overnight so we can watch you. Okay? Yes. Speaking of which, how does the throat feel? Not the best. I understand I'm here to take care of you, give you medicine for the pain, and help you with your healing. Okay, good. Okay. And are you comfortable? I can get a pillow or a blanket. I'll get one for you after the exam. Are you tired? Yes. And I do apologize if I am a bit quiet, en chuchotant, but there are other patients also in the clinic, so let's keep it a little bit quiet, okay? Très bien. I'm going to quickly check your vitals. Is that okay? Good. Going to first check your heartbeat. Okay. I do see on your charts that your health is good, but I must hear for anything in the heart or the lungs. It's a bit cold. Is it okay if I touch your chest? Thank you. Très facilement. Breathe in, breathe out. just trying to listen as well to your lungs. So, going to get some gloves on. So we're going to do exams all over you. You okay? Good. Now that I have some gloves on, I'm going to grab your temperature, okay? So you could just please open your mouth. I'm just going to quickly take your temperature, okay? And now we wait a little bit. That looks perfect. And I'm going to take a quick look into your mouth, the back of your throat. As you had your tonsils removed, I'm just going to take a look to see that everything is fine, okay? Just taking a look. You can look at me, okay? Keep your mouth open. Let me look. Okay. Good. And just going to carefully take a look inside your ears, okay? Let me know if you can hear in 3, 2, 1. Good, and now. Good, and now. Good, and now. Good. Any problems with your hearing or the other ear? And tell me if you can hear this. Très bien. And this. Good. And this. Good. And this. Très bien. Nothing in your ears. And I'm going to ask you a couple of questions, okay? Does your throat hurt quite a bit? Okay. Is it sore? Yes. Are you having any problems with swallowing food or... I understand. We had to remove your tonsils because they were infected. You will be much better now. And as you are on very strong antibiotics, I'm here to check and take care of you. Next, I'm going to quickly check up on your muscles, okay? I'm going to place my hands right here on your cheeks. I want you to smile very wide for me, okay? So may I touch your face? Thank you. Now smile. Good. And smile. Good. muscles can be a bit relaxed after we have done surgery next to your mouth. I'm going to put my hand right under the chin. I'm going to ask you to try and swallow for me, okay? So, you could breathe. Good. Good. Very good. Looking well. Going to quickly adjust your IV settings so that it works for you. Okay. Don't move, I'm just going to check them. Yeah, it looks like you need another fluids bag. I'm going to just replace that, okay? And it's working good now. How are you feeling now? A bit uncomfortable. So, what I have to do, as this is a overnight stay in one of our beds, I'm just going to check up and take care of you. Okay. Good. Très bien. First, I'm going to begin with applying a sterile solution around the mouth. Okay. So, what we're going to do is I'm going to ask you to take this medicine. And it's to apply liberally in the mouth, and so that it can help heal your mouth. Going to need to add about 10 drops, okay? Good. Just open your mouth, okay? I'm going to add 10 drops, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I'm going to ask you to try and move it around the mouth and swallow, okay? Very good. Now we're going to apply a bit of eye drops. I'm going to look into your eyes. Okay. When you have a tonsil problem, sometimes it can affect the sinuses, also affecting the eyes. Just going to apply some eye drops into the eyes, okay? Just a couple. Look up for me. Thank you. 1, 2, 3. If you could please just blink, blink, blink. Good. Just blink, blink, blink. Good. The other eye, look up for me. Thank you. So, 1, look at my eyes or my nose, okay? Just going to take a look at your eyes. 1, 2, and 3. Any problems? No. Okay. 1, 2, 3. Any problems? No. I'm going to carefully do something that we do. You can take the light and you can put it right to the skin to check the sinuses. And I'm going to check quickly for something of an inflamed or irritation with the sinus, okay? I'm going to carefully place it on the forehead first. Don't move, okay? Just applying that right there. No sinus problems, probably. And onto the sides of the nose. Just very close. And I see nothing, which is the best sign to see. Good. The other. Just going to take a look. I see that it is very, very good. No signs of infection. Good. What I'm going to do now is a cleansing of the face and then around the mouth a little bit, around the eyes, and we're going to just be carefully cleansing a little bit in the mouth, okay? Good. And first thing, do you have very sensitive skin? La peau très sensible. Okay. I have 2 types of products here. The first being a very strong medicine, which I will apply only on small spots. Right here on the mouth for moisturization. And then I'll take the rest of the skincare for you, okay? Good. So, going to begin with a little cotton where we use it as a sanitization. Okay. And this is very clean. Just going to use that to pat and cleanse the face, okay? Good. So, just going to very carefully going to pat, 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 pat. Are you okay? Does that bother the skin at all? Okay, so careful. I'm just going to another. And this time I'm going to get a medicated wash. This will be for right around the mouth. Okay. So I have a solution. This is something called Noxima. It has eucalyptus in it, bit of mint de menthe. That is for cleansing. So if you can smell that, it is of mint, it's so nice. Going to get another sanitized applicator right here. Very good. Going to take that, apply it into the cleanser, just like so. Okay. And we're going to apply that, okay? So, we're just going to good, yeah. Good on the forehead. Very easy on the chin and the mouth, okay? Good. I'm going to put this to the side now, and we're going to use one more to cleanse the face. So we get the little cleansing tool. Just going to take out one more. Just going to carefully très bien. Ok. Très bien, la méloc. Parfait. Very nice. Next, going to carefully apply something to the mouse, and I'm going to ask you to swish and swoosh the medicine in your mouth, okay? So, little oil here. We're going to be using this
too onto this Q-tip. Okay. It smells très bien. It's made of tea tree oil. I'm going to apply it to your tongue, okay? I'm just going to use the little tongue stick. So just open your mouth and I'm just going to apply this like so onto the tongue. Good. Good. Very nice. Très bien. Now if you could just swish and swoosh that in the mouth. Good. And then if you could swallow, that is a medicine. Good. Next, what I have to do is just carefully brush the hair, okay? Good. So, do apologize for getting a bit close, but we do have to go to the hair, and I'm going to be looking for lice, dandruff, a dry scalp. Okay. Just going to brush the hair, so. Okay. Look at me. Good. I did not see anything in your scalp, so you should be good. Just going to very good. And last but not least, as your vitals are good, I just changed your IV bag, which should be fine for now. I get to ask you again, are you feeling any better? Has the medicine started to work? Well, the pain in your throat is gone. Okay. Do you need anything to drink, or perhaps something to eat? We do have popsicles, ice cream. Okay, I'll get you that right away. And again, you asked for another blanket and a pillow. Okay, let me get that for you. Just going to. We always have them on standby. A pillow. Just going to place that behind you. Is that okay? Good. Just don't move. Good. And then a blanket. Let me pull that. Just going to carefully
Now, as for your health, if you need anything, let me know. There is a little button next to your bed. It's the one in red that says help. Anytime you need help, just touch the button, le bouton, and let me know, okay? Again, I am Nurse Geneviève. Enchantée, and I hope you feel better soon, okay? Good. Now you can relax, I'll go get you some ice cream. Très bien.
Thank you.